A call for accountability for January's water crisis. You're watching 8 News at 6. I'm Eric Phillips.
I'm Deanna Albritton. The Virginia Department of Health says January's water crisis was entirely preventable, and Richmond's Department of Public Utilities has known about its water system's shortcomings for decades.
8 News reporter Sierra Krug joining us live in studio after having the chance to speak with VDH about their recently released report. And Sierra, what did the agency have to say about DPU as far as what it should have done differently?
Well, Eric, Deanna, I think the simplest way to describe what the health department saw with DPU is the worst form of procrastination. VDH says it's clear the city has known about issues with its water treatment facility for decades. To quote the report directly, they say the staff essentially accepted substandard conditions as normal, putting off any proactive fixes until it was too late, like we saw in January. A dead eel by Richmond's water supply. Makeshift parts and debris floating throughout the system.
Simply put, we didn't know. We didn't know about it. We learned about it during the water crisis investigation.
Virginia's Department of Health rethinking their blind trust in Richmond's Department of Public Utilities after finding January's water crisis, although catalyzed by Central Virginia's severe snowstorm, was entirely preventable.
Complacent and reactive culture, whereby problems and known risks were not addressed.
The first of 3 core findings highlighted in this 300-page report, detailing why the city of Richmond and surrounding counties went nearly a week without water in January. Dwayne Roadcap says with the way Richmond's water treatment facility was operating, the crisis could have happened in 2020 or 2021, its vulnerability tested and tabled time and time again.
If there had been better operational decisions over decades, then the water crisis would not have happened.
He says the Department of Public Utilities operated the water system in a cost-saving winter mode, limiting safeguards. And it relied too heavily on manual operation, particularly in an undertrained and understaffed facility. Roadcap admitting the Department of Health conducts a thorough investigation into the water system every 3 years. Last digging into the facility in 2022, tag-teaming an EPA report, which flagged a series of concerns that went ignored.
I can't go back in time and say that we should have caught something that we didn't know existed. I'm saying that it might have existed, but we didn't see it.
He says the responsibility to report issues still ultimately falls on the city. We're told Richmond is listening, already switching to summer mode, updating failure plans, and more. The health department also making some changes.
One of the things that we're revisiting is how we do our inspections and the questions we ask. I think going forward, what our team is learning is we need to go another level. Don't accept it at face value.
Now, as for the scarier stuff like that dead eel and rust in the water, it's important to remember officials test our water quality frequently. So do not be scared to drink the water. The concern is about the system's long-term foundational issues. If you head to WRIC.com, you will see a full point-by-point list of what the city needs to fix and where their progress currently stands. The city has 45 days to come up with a timeline and plan to address the health department's concerns.